Hello and welcome to Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blakelock, and during this episode we're going to talk about issues that affect the ear, nose, and throat. And joining us today is Dr. Wilson, who specializes in ear, nose, and throat. Thank you for being here with us.
Thank you for having me.
Let's talk a little bit about, I know people have had ear infections before. Let's start with the ear. What are some common problems that you see in your practice?
Well, when we talk about ENT, often we talk about pediatric and adult. When we see young children who get recurrent ear infections, we typically are talking about middle ear infections. And this is the space behind the eardrum, where it typically should have air containing space. But for some reason in young children, they're more susceptible to getting fluid buildup behind the eardrum. And when that happens, bacteria from the back of the nose and throat can invade and cause an infection. They'll typically be irritable, sometimes have fevers, difficulty sleeping, and obviously having trouble with pain. So that's the biggest problem we see in young kids. And then as we get older, that problem tends to fade away. And then adults that typically don't get a middle ear infection, they're more prone to having pain around the ear. And often we will see patients that think they have ear infections as adults, but typically it's just a pain from their jaw joint, from TMJ dysfunction. So those are the biggest things that I see on a daily basis in both the pediatric and adult patients.
With ears. Now, with the children that are having ear infections, generally that is a common thing that happens obviously in childhood, during their childhood. Mm-hmm. So they would see their pediatrician, and then after it's come to a point where it might be problematic, then they would follow up with an ear, nose, and throat specialist? Yes,
typically when there's been enough infections, we move to a more invasive type of procedures. Well, really we're talking about ear tube placement. Mm-hmm. The reason we treat ear infections isn't mainly just for the ear infections, is to prevent a complication of the ear infection, such as mastoiditis,
hearing loss?
Prolonged hearing loss, things of that nature. And typically we're talking 3 episodes of an ear infection, middle ear infection, within 6 months, or 4 or more in a year. Those are kind of some criteria that we use, whether or not a child would need ear tube placement or if we would just continue to treat with antibiotics as these infections arise. Another reason that we'll see children that need ear tubes is that if they continue to keep fluid behind the eardrum, some of these children don't have the recurrent infection and pain, but they'll keep fluid behind the eardrum. And these children sometimes are difficult to diagnose, but when we do diagnose them, the reason we will often put tubes in their ears is to remove that fluid, because that fluid by itself is causing a conductive hearing loss, which can be significant and actually cause some children to have a speech and language delay.
So very important for developmental reasons to follow up with your pediatrician and also then your nose and throat specialist, correct?
Yes. Mm-hmm.
What about ruptured eardrums? Do you see that in both age groups, childhood and adult?
As ENT doctors, we do. We see a fair amount of that, mainly in pediatric population. A lot of kids can have a bad ear infection that will cause the eardrum to rupture. The good thing is the vast majority, somewhere probably 3 out of 4 of those patients, the eardrum will heal spontaneously. For those that don't, in adults that don't have the spontaneous recovery, there's some surgery, outpatient surgery, that can repair that. The reasons we repair that is to prevent any chronic infections, but also to help with the hearing loss, because that will cause a mild to moderate hearing loss as well.
We've been talking about infections with the ear. What about swimmer's ear? Do you see that in your office also?
We do. That's something that often primary care doctors, pediatricians, and family physicians can treat and treat appropriately, but in a subset of patients we'll see this where it doesn't seem to clear up with kind of standard routine therapy. Again, that's often in both age groups. We'll see pediatric and adult patients that will have significant pain, swelling of their ear canal causing some hearing loss, and we typically treat that with some antibiotic ear drops, and oftentimes they might need an oral antibiotic, mm-hmm. and even a small wick placed in their ear canal for a few days to help relieve the infection. But we see that as well.
Any tips? And I'm glad you mentioned that, because I know our viewers, many of them might think that they need to clean out their own ears. Do you have any tips for taking care of our ears?
I do. Most patients come in, and if I ask them about using a Q-tip They will blush and say, yes, I do, I know that's wrong. And I say it's not necessarily wrong. We, as in general, would tell people to move away from using those just because of the risk of injuring the ear. Ear wax by itself is good. It's normal to have wax. It's part of the cleansing process of the ear canal. It helps fight any ear infections of the outer ear. So most patients I tell just to try not let their ears get soaked with water. If you do, try to let them dry out. People that have a lot of problems with wax, typically just to use something like a hydrogen peroxide and water mixture and let that soak in your ear canals every couple weeks often will prevent a wax impaction. But for the most part, if you don't have problems with your ears, there's nothing in particular you should be doing.
Leave them alone.
Yes.
Sounds good. Well, let's move on a little bit to the end, and that would be our nose. And of course, we live in Kentucky. Everybody has allergies, it seems, within this belt. But sinus infections, broken noses, deviated septums, what do you see in your practice related to the nose?
We see a full spectrum of nose disorders. As you alluded to, living in the Ohio River Valley, we see a multitude of allergies. These allergies go all through the spring, all through the fall seasons, with trees coming in early through grass, and then ragweed season, which we're in right now. There's a lot of allergens that are all year, and we're talking about animal dander and dust being the two most common. But allergies are very common, something we see and we treat. I see that on a daily basis. A lot of patients have a septal deviation, which is causing trouble with continued congestion, difficulty breathing through the nose. These patients may have trouble snoring. Many patients I see that have that do not have any history of any specific nasal trauma, such as fracturing your nasal bones. So we're not sure if that's something developmentally as you're growing and learning to walk and fall and you hit your nose and the cartilages and the bone fracture and get pushed over to one side. But that's a very common thing that we see, something that typically we see and we treat very well with surgery. Most patients have a very good outcome with that. And then obviously sinus disease and sinus infections is something we see as well.
Now, people can actually have sinus surgery, is that correct, if it's a chronic situation that would need be?
Yeah, a small subset of patients that have recurrent or chronic sinus infections can be, that actually will need surgery. Most patients don't need surgery, and that's the good thing. As an ENT physician, we're trained to treat patients medically, and if those patients fail, then we move to a surgery. But most patients that have recurrent sinus disease or sinus infections, there's usually a combination of things going on. Many patients have a septal deviation that's contributing. Most patients have allergy as a component. And then on top of that, once their sinuses become inflamed, if we can't fix all that medically, then they may need a surgical procedure.
Now, next, we move on to the throat a little bit, and that's the T and the ENT component of it. And commonly, I know one that we all have heard of is tonsillitis, or having a tonsillectomy as far as the surgery is concerned. Is that very, I guess, needed and popular still for individuals to have their tonsils removed?
It is. Again, this is something that I think of as two different patient populations with your pediatric and adult patients. Pediatric patients still have a significant need for having their tonsils and adenoids removed. Your tonsils and adenoids are in the body to help boost the immune system as we age in those early years of development. They're part of what we call the lymphatic system, Wall-Dyer's ring, in the back of the nose and throat. And many kids who begin to experience recurrent infections have to have their tonsils and adenoids removed. Typically, again, we have used some numbers and to help us set some guidelines to when children need to have this. And most of the time, we're talking if children need 4 to 5 rounds of antibiotics in a year over back-to-back years, something like that, they may need to have their tonsils and adenoids removed. Adults typically will have less noticeable or acute symptoms when they have a tonsillitis. They typically have just some mild trouble swallowing. They may have an odor to their breath, and they actually may develop things layman terms, that people call tonsil stones, which we call tonsillus, which are little debris in the back of the throat. Those patients may need to have their tonsils removed if medical treatments are unsuccessful. Another reason that we take out tonsils and adenoids in young children is for sleep disordered breathing, and we're talking about young children that snore extremely loudly, get restless sleep at night, and seem to be not getting good night rest. Removing their tonsils and adenoids in over 90 to 95% of those children will relieve those symptoms.
Almost make a new child, because they'll be able to get that sleep and have that developmental advancements based upon their sleep, hopefully, right?
Exactly. There's been a multitude of studies over the past 10 years looking at not only the improvement in their sleep, but what the sequela of that is in terms of how their behavior changes, how they seem to do better in school, and it's all very important, obviously, as they develop.
Absolutely. Now, you were talking about tonsillitis. Can you differentiate between, is there a difference between tonsillitis and strep throat?
Tonsillitis itself is just inflammation of the tonsil. Strep throat would be, we're talking about streptococcus, which is a bacteria that can cause an infection in the back of the throat. Historically, streptococcus bacterial infections that cause tonsillitis are something that a surgical procedure with removing the tonsils would be needed once they've had enough infections. Sore throat can be caused from a multitude of things: viral infections, a bacterial infection other than strep, even chronic reflux and heartburn are things that can cause a chronic sore throat in children. So it's one of those things that if they're requiring multiple rounds of antibiotics or other medical treatment and they continue to have a sore throat, an ENT referral is probably needed.
And I think you're making a good point. Tell us how this is all related, because usually your ear, nose, and throat are functioning in a way together that if you're kind of clogged up, I hate to say, in one area, it could actually affect the other. Is that correct?
Yeah, a lot of people I will see have come in with an ear problem, saying that they feel pressure in their ear or fluid behind their eardrum with some hearing loss. And it's almost always related to a concurrent nasal problem. They may have a flare-up of their allergies, or they have a viral infection or bacterial infection in their nose and sinuses. And one of the reasons we talk about that connection is there actually is a connection called the eustachian tube, and that's often why people will have an ear and a nose and throat problem together. And once we kind of get that underlying problem fixed, all the symptoms can be resolved.
By looking into the whole picture and the whole gamut, checking the ears, the nose, and the throat together, that person can feel much better by finding out really what's causing all of it, isn't it?
Mm-hmm.